Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yeah, I thought they said you could get 8 more. Yeah.
Well, apparently that's the limit, huh?
I definitely applied, but
They said eight is the top, huh?
right. I'm able to pick them up at the library in Bethesda.
Oh, good. Okay. All right. Okay. 1.8 billion tests have been distributed. That's amazing. Probably more people are doing a test than are taking the vaccine.
It also shows that it's not gone. You know,
Yeah.
people are acting like it's gone. But I notice in the grocery store, I go to the grocery store 2 or 3 times a week. More people are wearing masks in the grocery store now.
Well, I just finished flying to Atlanta, and they aren't wearing masks in the airports though. I didn't see anybody except me with a mask in the airport. Maybe one or two others, but that's rare.
Okay.
Yeah, let's go to the next one. Those of you cinnamon lovers, they complain that there's some of these cinnamon products are contaminated with lead. As we all know about the lead problems that have plagued us, especially in Michigan, in the water. But actually, it's all over in the houses and so many places that have lead in them, which is not good. So it's harmful to children and adults. So, of course, applesauce, we have it. I like cinnamon applesauce. Said they reported it. Doesn't say what kind of applesauce. Wanna banana. I don't know who that is.
Wanabana.
Yeah. I don't know who makes the, I have to look at my package of applesauce, see who makes it.
Alrighty.
It
This
doesn't.
is stuff. What'd you say, Betty?
Now I said it doesn't give a type, does it? I know Mott's and I'm a cinnamon applesauce person myself.
Yeah, me too. Yeah. So I have to look at the bottle and see what it says. This is interesting that they shortened the isolation period on COVID isolation from 5 days to 24 hours, which is quite a difference. Of course, it recommends that you stay home while you're sick anyway, but how many people are going to follow that? I hope many. They emphasize that most of the people who are in the hospital and dying from COVID are people over 65.
And unvaccinated.
And unvaccinated people, right?
So I heard them talking about a new vaccine. Is it out yet?
Should be out by now, yeah, because they've recommended that all of us over 65 get a booster if you received the vaccine more than 4 months ago.
Okay. Okay.
If it's under 4 months, they suggest you wait for 4 months, 4 to 6 months before getting the booster.
Mhm.
And it should be available by now because they announced that last week. So
Mhm. Okay.
This article reinforces what we're talking about. People just not really caring about COVID now, since the CDC said you didn't have to isolate for 5 days anymore. You know, if somebody gets it, they're gonna go right out and give
no,
it to
they're still
somebody
supposed to
else.
wait 24 hours.
Yeah, but what I'm saying is that okay, they wait 24 hours, maybe, you know, uh, then they're gonna go right on out. I kind of think it's still infectious. You can still give it away after 24 hours.
I kind of think
Well,
people are treating it more like the flu.
even with the flu, you're supposed to stay home until you're asymptomatic. The same thing with COVID.
Yeah.
Uh, The isolation part is just one aspect of it.
Yeah. Yeah.
The other part is that you still should stay home until you recover.
Yeah. They said as long as your fever is down, that you can go.
Yeah, right.
Mhm. So, who takes their
How
fever?
many people even take their temperature at home?
That's just what I was saying. Who takes their fever? I, d- I have a thermometer. I don't take it too often though.
It's important to have because you're trying to differentiate between shortness of breath from the flu and a heart attack. You don't have a fever with congestive heart failure, but you have a fever with the flu.
Even though this is CDC, certain states are taking different stands. Is that the case?
Yeah, well, Florida's they do what they want to do. The Surgeon General has contradicted the recommendations of the CDC. So, but that's what CDC is for, to give you recommendations. It doesn't mandate that you follow them, but they give you advice. I hope everybody is going to get that second booster shot. This is exactly what John just said, emphasizing stay at home while you're sick, regardless of whether it's COVID or not.
All righty.
Yeah, this is an interesting article. It says that yogurt might reduce the risk of diabetes. Type 2 diabetes. Remember, type 1 diabetes is the one that you have no insulin, and type 2 is you have insulin, but you're resistant to it. You have antibodies that prevent you from uh, utilizing the insulin. And that's why the transplant is recommended for the uh, people who have no insulin, and may not be recommended for people who have insulin sensitivity. It depends what their insulin levels are. Any of you like yogurt?
I do.
Hmm. Not many yogurt
I mean,
enthusiasts.
so yeah.
Are they talking about the yogurt without that much sugar? Because I heard that yogurt is loaded with sugar.
They're talking about yogurt. They don't specify. It's in there. I just read it, that it says independent of fat or sugar content. Yeah, it said something about the flavored yogurt is higher in sugar content. I saw that somewhere. Maybe
Right here, yeah, you're right.
Mhm.
Second paragraph,
Yeah,
right.
yeah. And that wasn't, they weren't necessarily talking about that kind. It's up in the article.
Yeah.
Right.
If you say you like yogurt, it's probably the flavored kind because just unflavored yogurt doesn't taste that good. But you can get the unflavored yogurt and add some fruit to it. And it's better to add raw fruit because if you're adding any type of prepared food, it's got to be loaded in sugar.
Yeah, that's what it said. I don't like it, so it doesn't matter.
But this article is written more for white folks because they can tolerate yogurt a lot better than black folks. Most of us are at some degree of lactose intolerant, and we just don't realize it because we think that lactose intolerant means that your stomach hurts. But there's a lot of variations of lactose intolerant, and it doesn't do us any good as black folks.
Any other comments on this article? Not unless.
Yeah, some people like the yogurt that doesn't have any sugar in it at all. It's just the taste of it. It's almost like a cream cheese kind of a taste. Some people really like that.
This is an interesting article in the sense that we've known for some time that some of the herpes viruses produce Kaposi's sarcoma and other types of cancer diseases. And the findings kind of point out once again that viruses may be induce cancers, and at least some cancers. And this knowledge of this may help in identifying treatment for cancers. Patients who have transplants and get these viruses, one of the ways they treat the cancer produced by this is by stopping the immunosuppression, because you need your antibodies to help fight off the cancer. We also now know that we have autoantibodies that sometimes prevent our own antibodies from killing off the cancer cells. And so we have to then find ways to reduce those antibodies that are preventing our own antibodies from killing the cancer cells. And so this can be therapeutic, but this is something that we've noticed in transplantation for some time, that certain viruses in transplant patients result in increased incidence of cancer.
Human papillomavirus has been known to be associated with cancer, especially
Right.
I mean,
Especially
a vaccine for early adolescents in the hopes of preventing it.
And a recent study showed that it is very effective. The one thing I'd add to that, Lucy, is that it's so important that the males and the females get this vaccine, because the males are often the source of the human papilloma virus, and so that. But it's been shown to be extremely effective, and so it's it seems to be very important that the kids get it in school and before they go to school. And then, of course, as you mentioned, it also is the cause of oral cancers in males. So that's another example of a virus that we know causes cancer. Thanks, Dr. Perez. Any
It
comments or
opened
questions?
up one of the obstacles was getting parents to appreciate the fact that their children were sexually active. Because you have to make the decision early in life, as you pointed out. And if we could get to the point that it was provided the same way we do for healthcare maintenance with measles and mumps, and then we would have a significant decrease, and policy would override ignorance.
That's a tough order. Thanks for your comment. This is an interesting article about virtual reality and medical training because much of the surgery now is being done the training by simulation. As a matter of fact, in every surgical program, it is required that you have a virtual training, virtual reality training, and before every surgical procedure. And so and the best treatment, I mean, the best way to prepare for that is by doing the video games. And so your children who want to spend a lot of time playing video games is good practice for surgery, and it's becoming a vital part of the training of all doctors. So once something that was thought to be optional now is really becoming mandatory, because virtually all of the surgery we're doing, we do it beforehand by simulation. In addition to which, much of the surgery is now laparoscopic or robotic. Much of it is, and this therefore is good preparation for that. So when I interview students, I talk to them about the fact that video games are good preparation for future surgical training. But that's not to imply that it's only used in surgery, because it's used in all training for medicine, whether it's surgical or non-surgical. Most of it began with the laparoscopic work that was done in OB, and now that's expanded throughout all surgery. So it's really now imperative that you know about simulation and virtual reality training.
Dr. Callender, what is laparoscopy?
That's a procedure where you put a tube into the abdominal cavity and you actually look around. That's what laparoscopy is. And then they do surgery by the same technique. And that's laparoscopic surgery, which is the kind of beginning of the videoscopic surgery that is first began in obstetrics and gynecology, and now is really involved in all surgery. So often, much of the surgery, the first surgery they'll do is laparoscopy. That is, they go in and look around and see what is the problem, and then, if necessary, they can proceed with surgery by that mechanism or open up and perform the surgery. But that's what laparoscopy is.
Does that include the colonoscopy? Is that the same thing?
No, colonoscopy, they just go inside the intestine and look inside the intestine. The laparoscopy, they look in the abdominal cavity and look at the internal organs.
Dr. Callender, laparoscopic surgery produces less scarring tissue. The kidney, when you take kidneys out, you could do it laparoscopically.
Yeah, there's a lot of discussion about that. Some laparoscopic surgeons will say that. I'm not positive that's the case because they have genital obstruction after laparoscopic procedures as well, but it may be less. But it's certainly true that they have less pain and they stay in the hospital for shorter periods of time.
Mm-hmm.
So, Dr. Callender, I I recently rewatched this movie about Doctor Strange. It's a Marvel kind of like science fiction movie. But Doctor Strange was a neurosurgeon, and part of what he did, he was manipulating some nerves and things. He pulled a bullet out of a person's brain, but it almost looked like a video game as he was doing it because he wasn't looking at at the the object itself. He was looking at the screen. So even though the screen was a video of the person, he wasn't really looking at directly at the person. It seemed like, this virtual reality almost.
Yeah, much of the neurosurgery is done that way now. The real sophisticated surgery that involves a millimeter or two in the brain, and you can't make a mistake. So you're right. That is important part of neurosurgery now. It's actually an important part of all surgery now, but neurosurgery especially.
So they include that training now?
Yes, it's mandatory in all surgical programs.
Okay. Wow. It's pretty intense.
Yeah, but it's like anything else, practice makes perfect. And they are now recommending before you perform any surgical procedures that you do it by simulation first and then proceed with the surgery. This is something that we've discussed often, and there's so many health problems that are linked to ultra-processed foods. I think we've talked about ultra-processed foods in all of our conversations, all of our programs, and I think this is what Dallas mentioned, that they put in additives to make people eat things that taste better because they have a lot of sugar and other things. And as a consequence, these added things to make you eat the food are associated with a number of, you can see some 30 plus chronic diseases. Of course, there's so many that as you eat and enjoy your food, you can often think of what disease you're going to get from the food you eat. Unless you're a vegan and of course, even vegetarians have high cholesterol and other problems. But it's clear that the ultra processed foods, and that's another subject. What are the ultra processed foods? And you see what they have up here: the frozen dinners, sugary meal, cereals, potato chips, and all fast foods. And that's the price we pay for that.
Yeah. As far as vegan substitute meats like Beyond Burgers, Impossible Meat, any type of vegan sausage, bacon, or chicken, they're all ultra processed.
Mm-hmm.
Now you tell me. And I was just enjoying them too. They were so good.
No free lunches.
So how do you get the burgers? They even sell them in the store where you cook it yourself. So you can't eat anything like that unless you.
Yeah, well,
Oh,
they're
You can eat it, it's
convenience
just ultra
foods.
processed.
Yeah, they're ultra processed. They're convenient. You know, usually you get them in the frozen food section, which means that you can heat them up, eat them quick, and die faster. But if you want some vegan alternatives to meat are things like mushrooms, jackfruit, beans, and tofu. And they're not ultra processed, but you do have to prepare them and cook them.
I gotta cook.
Yeah, you gotta
You
cook.
gotta cook.
Yes.
Okay.
Just like your grandmother did.
Oh, that was long and hard. You stayed all day in the kitchen. Shoot.
I like mushrooms.
That's why grandpa went to work and grandma stayed home.
Those were the days, huh?
I don't know. They were before I was born.
Okay.
My mother was born in 1903, and she used to hear people saying those were the good old days. And she would turn and say, no, they weren't. They weren't the good old days. Having to go to outhouses and having to do this. She said, no, those were not the good old days. Okay, Betty, you remember washing machine where they had the wringer and you get your hand caught up in it? That's the first kind I ever had. Yeah. And hanging up clothes. I guess it was good exercise, but I surely didn't like it. Yeah. I like the dryer. Yep. Men, they don't care. Stayed white or hanging up on the line though. I don't care.
Okay, any other comments about that? Because we've all been there. Us older folks, we've all been there. The good old days are good old days if you forget about the things that weren't so good.
And how you had to can fruit and can vegetables and all of that. That was sweat.
And
tired on your feet all day.
Ice boxes, you remember those ice boxes?
Then you had to carry the ice to it. You couldn't just plug it up and have a freezer. And now it's the frostless. You don't have to defrost it anymore. I like today. Yeah.
This is another article about decreased colorectal cancer as a consequence of low dose aspirin. Aspirin has been used for many things, some of which are still recommended and some are not. But recent studies pointing out that low dose aspirin is associated with a decreased amount of colorectal cancer. Now, of course, this study is based upon Norway, which is not known for its African American population. But a number of studies have demonstrated that this is associated with a lower incidence of colorectal cancer. Now, we know that many people are taking aspirin for low aspirin because their cardiologist put them on it. But this is all an added benefit, allegedly. What needs to be done, though, is these studies need to be done in populations that have more people of color in them. This study does not.
And Dr. Callender, I'm really confused. I mean, I used to take the baby aspirin, and then somebody said you shouldn't take it, and then now somebody said you should take it. I'm really confused.
The data is clear that if you have no cardiovascular problems, that there's no need to take aspirin for cardiac reasons. On the other hand, if you have cardiovascular diseases, then the question is the risk of bleeding from aspirin greater than the risk of preventing the cardiovascular disease? And the data is mixed. There's a lot of data that says that if you have cardiovascular disease, a low dose of aspirin is helpful. And there's data that says that aspirin decreases the ability of platelets to clot, and therefore you may get bleeding as a side effect. But most people believe that if you have cardiovascular disease, the benefit-risk ratio is such that the risk of bleeding may or may not be as great as the risk of getting a stroke or a heart attack. So the data is mixed, but I think the majority of data suggests that taking aspirin, low dose aspirin, has some risks, and the risk of bleeding. Not taking it also has its problems as well. So you're rightly confused because the data goes up and down, and but there's a potential benefit of aspirin for people who have cardiovascular diseases, but there also is a risk of bleeding.
So,
So
Dr.
so
Callender,
that if you're going to take aspirin, it would be the low dose aspirin.
of course, I looked at my report from my primary physician and said that I'm a suspect for atherosclerosis. Is that correct?
Right. Yes.
So that's cardiovascular disease?
Yes. Very much so.
So if I don't have bleeding and my father did, because he had 4 strokes.
Did he have the hemorrhagic stroke or did he have the clot stroke? Which one did he have?
It was the minor one, the clotting.
Well, let's see that might be protected by low dose aspirin.
Okay.
Remember the 2 types of strokes: the hemorrhagic stroke, which is usually associated with hypertension, and the thrombotic stroke, which is where you have clots. And nowadays, we talked about how the clots can be removed, but the low dose aspirin is protective against the thrombotic stroke, not against the hemorrhagic stroke.
So would the low dose aspirin affect your blood pressure?
No, no, it will protect against clots, and it may help you if you have atherosclerotic diseases or cardiovascular disease. But it will not. So it is protective. Most people will recommend not only the low dose aspirin, but also the statins.
Right.
The combination of low dose aspirin and the statins is thought to be protective against cardiovascular disease, but there's controversy on that. Dr. Perez, you still there? If you have any comment on that, because this is, and actually next week.
I
Next
thought
week.
you handled the controversy very well, Dr. Callender, because it is, I can get with this, I can get with that. I can get with this, or I can get with that. It changes back and forth.
Yeah. Actually, Dr. McDonald Pinkett is going to talk to us next week about an ounce of prevention and pound of cure. Talking about how we can prevent a lot of these things, and we can also ask her about that question when she talks to us next Thursday.
That's
This-
exciting.
I noticed in the medical field at some point they changed from the curing side to the preventive side. Or have you think they've always been on the preventive side? Medical.
This is an article that talks about the Medicare drug price negotiation program that we mentioned a couple of weeks ago, in which the Medicare is going to try to decrease the cost of medication. And so they're going to negotiate down the prices. And you can see here that one of the companies rejected the idea, and this judge upheld that. And what it will do will save money for us, to decrease the amount of money that it costs for many of the high cost drugs. And of course, the pharmaceutical countries aren't excited about that, but we are. And I think patients should be in the fact that they should lower prices mean lower profits. Yeah, right. You know, when you look at the billions of dollars that Pfizer and many other companies got from COVID, you
Yes.
can understand.
Dr.
Yes,
Dr.
Elizabeth?
Yes. Good morning again, everyone. Now we understand why we see all these commercials. Keep the government out of pharmaceutical.
Yeah, right. Absolutely. Because they will have lower profits. Yeah. So this is benefits us, not them. Dr. Perez, you had a comment?
I was going to say, as it relates to Pfizer, COVID took Pfizer out of the cemetery.
Yeah. And take them up to the luxury suites.
Yes. Yes.
Yeah. Well, that's very interesting to see what happens as it goes up to the Supreme Court. So the Supreme Court has made some awful decisions. So
Good morning.
Hi, Caroline, welcome.
You have a headache, I think,
But
the last
it's
couple weeks ago. Are you feeling better?
Yeah.
Good. Good.
It's
Yeah,
gonna
you
be-
can send it out, but this
going to be interesting to see how Supreme Court deals with some of the issues. They made some awful decisions in the past, and so it's going to be interesting to see if they continue to do that. We're going to suffer from the consequences of the civil rights, the fact that ethnicity is no longer an issue, and they'll be pummeling us and punishing us with that for the next few years. And we're going to see some of the consequences of that shortly. We have some articles that talk about people who are anxious to get away from equity and inclusion. You know, they like the fact that they would like not to have diversity. Anyway, it's going to be interesting to see what happens over the next couple of years as they try to restore how things used to be. Make it once again great to be white again. But anyway.
Make America white again. That's exactly it.
Yeah, that's it. This is something that's a bit avant-garde in terms of a way of treating strokes by who are paralyzed by putting on a device that may relieve spasticity better than the standard Botox injection. And this is for people who are spastic after strokes and cannot use their lower upper extremities. And so this kind of glove kind of thing that they have has been shown to reduce involuntary movement of patients with Parkinson's and also patients who have had strokes. So this is very new, and it's something that stroke patients had to deal with and can develop or worsen after stroke. And so this is a new device. This is brand new, so it's not available on the market, but just to let you know, as we're in a group that is likely to have strokes, this is something to know about if you have spasticity. They wore this device for 3 hours a day for 8 weeks, and they were able to have less of that spasticity than they had before. And so that this is thought to rewire the brain and send the sensory signals to the brain, which overcomes the spasticity. How this is going to really work out, this just lets you know that this kind of treatment is available now, but it's not generally utilizable. It's not FDA approved yet either. Anybody in this program ever had a stroke? Have family who've had strokes? Strokes are a common way for us to leave the earth, and
My mother and father had strokes.
I have a very good friend who's had a stroke, and I played for Keno with her, and I noticed that we were just joking around because it was cold in the room, but she always wears a glove on the hand that the stroke. And she said because it's cold, we were asking her why. And she said her hand stays cold. So I guess that's a product of what happens.
yeah.
Yeah.
Dr.
So-
Campbell, explain mini strokes, because I've heard people sometimes have had a mini stroke and didn't realize it. Is that possible?
Yeah, a mini stroke is we call it a mini stroke because it actually is to make it simple, it's a stroke that goes away within minutes, and it is a prodrome or a sign that if you don't go to the doctor and get it taken care of, you may have a major stroke that does not go away. So a mini stroke is a warning that you need to go into the hospital, get tested to find out what you can do to prevent having a major stroke. So it's that's why if you have any signs of a stroke, whether it's paralysis of going blind or your face twisting or any temporary loss of consciousness or anything like that, you go to the hospital and be tested and studied, because very often the mini stroke is a warning that you're going to have a stroke subsequently. Any other comments or questions about stroke? Dr. Perez, any comments? Although I know you're a pediatrician, but anyway, any comments?
I had a comment, Dr. Callender. When we were kids, especially junior and senior high school, sort of, somebody said you were spastic, right? That was like a put down. I didn't know it was an actual condition.
Yeah, spasticity means that your muscles are in constant state of stimulation. And so your hands are, whatever part of you is in spasm, okay, in spasm. And that means you can't relax. And so you're tight, your hands are tight. That's what they say you're spastic, because you're tight. But for after a stroke, these spasms can prevent you from playing a piano and other such things, because you're no longer flexible. Spastic is the opposite of flexible. Flexible, you can move around. Spastic, you can't. You're stuck in one position or the other.
Bringing in pediatrics, the insult that occurs with the diagnosis of cerebral palsy is one in which there's a lot of spasticity. So children who, in the birthing process, did not get enough oxygen to the brain, they result in spastic muscles and, their gait, walking on their toes, different things like that. And it's the same process that occurs on the other end of the spectrum when you have a stroke and you are a seasoned citizen.
Thank you very much, Dr. Perez. This is it was interesting how this was titled. The disease that affects more than 1 billion people around the world is obesity. Darryl has talked about the fact that we are the country that has more fat people than anybody else. More than 50% of our population is overweight or obese. And actually, this is a problem of the world. Of course, we are top of the line in terms of having so many overweight people, whereas the people who are starving in this country in the world, they have malnutrition that is associated with death and starvation. So this is the opposite of that, and it's a problem that is prevalent everywhere. Although it's not as common in the European countries as it is in the United States. But this lists the areas that also have obesity issues. It's interesting, 177 countries. Obesity rates are higher than underweight. So you got two extremes: people who are starving because they can't eat, and you got people who eat too much and they're obese, and you die from both extremes. So the question
I'd have
is,
to say Gaza is at the other end of that extreme.
yeah. Any other comments about this interesting observation?
I kind of realized, well, I not realized, I knew I was overweight. I'm 5'1.5" tall, and I had gotten up to close to 200 pounds. So I realized not only in how I felt, but I just knew that was too much weight. So, and looking at the charts that they have about weight and height and all of that. So I am in the process now of losing weight. And I'm down to, when I weighed on the 1st of March, I weighed 160. But the
Tremendous.
the more I look at myself and all this excess skin hanging, and I'm wondering how What are some exercises that I can tighten up my skin now that I've lost the weight or in the process of losing the weight?
I recommend yoga.
I don't know that my body's flexible enough for yoga.
Well, that's how you get it to be flexible.
Oh,
Do yoga. Yeah. Stretching. That's an article we had last week. I don't know if we talked about it, but stretching and uh, yoga itself can help to tighten up those. You know, I'm dealing with the same thing. 2 years ago, I weighed 205 and I'm 5'7", so I know what you're talking about.
mhm,
And the other day I weighed 180, so I'm down 25 pounds,
mhm.
mostly from swimming, but also from yoga, because I got the love handles on the side and the fat tummy, so still working on that. It's getting better though.
Any other comments? If not,
Dr. Callender, Betty, one thing that I did after COVID, and I continued, I do Zuma for seniors 60 over for 45 minutes. And it has a combination of a lot of things.
yeah, it's a nice exercise. Yeah.
I have dropped
They
foot.
talk about dancing as being one of the best exercises you can have. Of course, not as great as swimming, John, but it helps.
Well, before I had dropped foot, I was walking, which seemed like, but a lot of those exercises you all talking about now, I can't do. So
Oh.
I'm, I don't know.
Well, try YouTube and ask YouTube to find you something.
Yeah, I can do that.
Elizabeth, I didn't know you were over 60.
Oh, yes, John. Yes, John. Yes.
Any other comments? If not, let's.
What do
Yes.
they do with people that are overweight and they're from 600 and they get down to 200 and they got a lot of skin left over? I thought the only way you can get rid of that skin was to cut it off. I mean, surgery.
I don't know the answer to that question.
I'm listening kind of for Darryl to pop in with something off of Google, but I see he hasn't.
Okay. I just pulled up an article, How Do You Tighten Loose Skin After Weight Loss Without Surgery?
Okay.
And I haven't had a chance to read it yet, but I popped up the article.
Okay. That sounds like you.
You can
Good.
donate to somebody, I guess.
Okay, this next article is something we're going to have to face over the next 5 to 10 years. We've spent so much time trying to eliminate bias, and now people are saying, what's wrong with bias? What's wrong with the lack of diversity? And so for the next 5 to 10 years, maybe we're going to have a lot of lawsuits, and we're going to have a lot of people who favoring racism. So it's going to be an interesting bounce back that we're going to have to be dealing with. So look forward to it. It's only just beginning. The worst is yet to come. And so in terms of jobs, in terms of everything, the lawsuits about the fact that you require bias training and anti-bias, and so they're going to fight that. So the Supreme Court has really done a great job for us in terms of making life even more complex and more difficult than it was, because the people who have been hurt by diversification and who love implicit bias are waking up and proclaiming that they have a right to be biased. What do you think?
There's no law against it.
Well, yes, there's going to be a law against it. Yeah, that's exactly what they're trying to do, is to have a law against it. But so far, they haven't won any cases. But the Supreme Court made it possible for them to win some cases.
That's why it's so important for us to disseminate this information and remind the youngins. You know, we were talking before about the way it used to be, and that wasn't the good old days. But, you know, this is basically saying Jim Crow, you know, is where
Jim-
we need to go.
Right.
And the youngins don't appreciate what that was like. And wisdom experience needs to speak out about what this can be, because it's frightening.
Yeah, because we lived through it, didn't we? And we
Yes,
know how bad it
barely,
is.
Yeah.
Yeah.
barely.
And
Yeah, I
that's
remember Herbie and Vernal fighting all that stuff. And now here we go, we're back into it. So in many ways, where we were the good old days.
I do know that I sit down with my grandchildren and tell them about some of the things that I went through and my mom went through, and she talked about it a lot. So even, you know, segregation and all of that, they don't really have an idea. You know, they're clueless unless someone really tells them and expresses really how things were, or telling specific incidences of what happened to you or someone in your family or something like that, to kind of bring it home to them. But my grandson will tell you, what, so what? I mean, I don't remember, I didn't have to do any of that, or I wasn't doing, you know. But if you sit them down and talk to them and let them know that, you know, and now they're trying to bring it back, then, you know, maybe they'll understand it. But they really don't have a clue, the young people.
It's quite a crisis.
Yes.
And it's only just begun. That's what is the frightening part of it. It's only just begun. Yeah. Any other
I
comments?
know, I know, as a mother of grown children, waiting for some grands, but it's important for us to put on our Teflon coats and still tell the truth and still tell our stories, even though it may look like they're not listening. They may not be listening, but they hear. And a circumstance will come up and your words will have an impact. But I know I have to put on my Teflon suit when I raise my opinion.
Yeah. Okay. Any other comments before we move to the next slide? We're going to be seeing this, more and more of this.
I think to make it relevant to children, you're going to have to apply it and show them how it is today, of that subtle racism that's actually happening today. Other than that, they'll say it happened a long time ago. Children, even us, we tend to do that. And that happened in the back in days, as we used to say. It no longer happens today unless someone can show us the relevance of how it is actually happening. a lot of teachers across both races are actually demonstrating this even in the classroom of the biases and the racism that's actually going today. I was talking to my daughter-in-law and children, the part of Maryland that they're in, kids are kids. They don't see it. Everybody's an in, whites and blacks, and they don't think a thing about it. And if you try to explain to them that it's detrimental to us, they don't see it because they're treating each other the same. So you're going to have to find something that's relevant to them that they can't have. But other than that, they'll just listen to our stories of days of ore. We do the same thing with the Bible. That happened in the Bible, but it doesn't happen anymore until you can show someone that these things are actually happening today.
They're happening today and they're going to happen more and more. So we won't have a shortage of examples soon. We may not have them right now, but in the next year or two, we're going to have many. This is an article about how cognition changes before dementia hits. And I know some of us are dealing with relatives who are having the changes of cognition that occur before, and they really lose it, so to speak. And as they manifest these memory deficits, and I think it's important for us to understand what patience is, because that's the one term that seems to come to mind when you address people whose cognition is changing and dementia is in their future. And it's a terrible thing to see somebody who suddenly is no longer the same person that used to be, doesn't know you anymore, can't speak anymore, and conversation suddenly becomes irrelevant. I had a good friend who actually is the reason I got accepted into medical school, who developed this kind of change in his ability to think. And suddenly, when I spoke to him, he didn't understand a word I was saying, and I didn't understand a word he was saying. And shortly thereafter, he died. And one of the ways it presents itself is that they talk only about the past, and they aren't able to interact with what's going on today, but the conversations are all about the past, and what is today becomes irrelevant. Eventually, it's all forgotten. Have you had experience with dealing with people who cognition first changes and then they become demented? At our age, we're likely to encounter people who fit into that circumstance.
I have a question, Doc. Can you explain a little bit in more detail what cognition means?
Cognition means being able to understand what somebody is saying when they speak to you.
Okay.
That's what cognition is. So that when I speak to you, you hear me and understand exactly what I'm saying. That's cognition, and you're up to date with what's going on. You know what day it is, you know what week it is, you know what year it is, you know where you are, and you understand what is being said to you, and you are aware of the circumstances surrounding today, yesterday, and tomorrow. And that's the first thing that people lose when they lose their cognition. They're no longer relevant to today. Their mind's in the past, and what is happening today becomes irrelevant.
My My brother has dementia. He's in a nursing home. He's 3 years older than me. So we're the closest siblings. So that's who I grew up playing with and everything. But he really does not know me or anything. And his speech is not as it used to be. So I don't understand. Takes him longer to get words out and different things. But thinking about what you said about the past, when I went to visit him on his birthday last year, I took him a card, and when I gave him the card, I said, here's your birthday card. And he turned to me and said, I guess you gave Bunny one as well. Well, Bunny is my oldest brother who has passed in 1998, but they had the same birthday. And he remembered that that was his brother's birthday, but he didn't remember who I was. But he remembered that was his brother's birthday. So it's kind of
It's one of the most difficult things to see people who
yes,
you know and love, who no longer know you,
yes,
and no longer know what's going on today.
yes.
Dr. Callender, why is it individuals with dementia or Alzheimer's really remember the past and people in the past? And the brain is allowing that to happen, whereas it will not allow the individuals to know what's going on in the present.
Your question to me is, why is that? Is that your question?
I guess I'm just trying to understand why they can always remember and say, where is so and so who was already gone, like Betty said. And yeah, I was trying to figure out why the past comes up in their brain.
I have
know.
no idea. I have no idea, but I just know that that's what happens with it. And that's what I with my friend. He only talked about the past, and then after a while, he lost that too.
Okay, so I guess there's been no studies in why the past comes up versus the present.
None that I've seen.
I see.
Yeah, I experienced the same thing, and it's well documented that that happens. The short term memory disappears quicker. It's like an eraser from the present toward the past. Eventually, the past will go away as well, but the long term memory. My mom remembered things that happened in her childhood, just crystal clear, absolutely verbatim. But what happened 10 minutes ago was gone.
Yeah, that sounds just about right. Because when they say you're losing your mind, you're losing those current memories and going backwards, just as you said.
Yeah, there's some thought that Alzheimer's dementia is caused by brain plaques, and that there are certain regions of the brain that cover current memory and past memory. So possibly the brain plaques are affecting the current memory areas, but are leaving the past memory areas somewhat unaffected.
Any other comments before we move to the next article? Okay, let's go to the next article. This is, this is something that we talk about, the fact that there are side effects to vaccines. And some people have talked about autism, but there is a known association with Guillain-Barré syndrome. And this is a neurological condition. And it says for RSV, 2 cases per 100,000 vaccinated people. But for those 2 people, it's serious business. And the question is, if you're not one of those 100,000 people, you think nothing of it. But if you're one of those 2 people, this is something to be aware of. So there are side effects to vaccines, and although they're very rare, they still occur. If they happen to you, then they're 100%. Any comments about this? Is something that we have to keep in mind that yes, there are side effects to vaccines. Some are inconsequential, but some are very consequential.
Were these side effects noted or mentioned when the RSV vaccine came out? Because I'm thinking if people heard that, they may have been somewhat reluctant to get it. Was it?
Well,
was
I
it-
think that probably is true of every vaccine, that there's a probably 1 in 200. I don't think anybody told them no, that 2 out of 100,000 people will get Guillain-Barré syndrome because they didn't know it. But so they wouldn't know it until after it happens. So yeah, no. So most people were not told that 2 out of 100,000 people would get Guillain-Barré syndrome.
I have a question, Dr. Callender. Is Guillain-Barré, is that present beforehand and vaccine
No,
just brings it out?
it's a side effect of the vaccine. Why it occurs, I'm not sure. But no, it was not there before. And it occurred afterward. And why it occurs as a complication of the vaccine, I don't know. But it is known to occur with all vaccines. The only question is how often.
Glad my husband's not in here today because he didn't want to take vaccines in the first place. So he heard this, he might revert back because he has taken all of the COVID vaccines, and he took the flu and the RSV this year. This is the first time he's taken a flu vaccine, I think, since I've known him, and so it's, I don't want
Has
to.
he ever gotten the flu? Has he ever gotten the flu?
If he did, he didn't know it, and neither did I. He might have, he might have just said it was a cold or something.
Well, it's important to know that there are risks associated with everything. There's no medication you take that doesn't have a side effect. And one of the things that is frightening is that if you read the PDR for any medication that you take, you'll have about 2 pages of side effects that are associated. And so question is, do you really want to know? I don't know.
Yeah.
I've read all those side effects, and the only thing I'd say is that there are side effects. If you have any complications after taking the medication, let me know as soon as possible. And one of the things that I'm unhappy about is that often when patients have side effects and they call their doctor, they don't get a call back, maybe for days or weeks. And this is not good, because it's important, if you had a side effect, let the doctor know so he can reorder a different medication that has different side effects. But I've spoken to a number of people who've had side effects and they call the doctor. The doctor's office does not call them back in a timely fashion.
Dr. Callender, I've noticed that on these commercials now for different medications, I watch the Weather Channel, and half of the commercials are for medications. And now more and more and more of them have more and more possible side effects that they announce. I mean, it used to be like, you could have a headache or get diarrhea. Now it's like 5, 6, or 7 or 8 different possible side effects, and they have to advertise them, to protect themselves. You know, these are possible side effects. And if you take this medication, it's not going to be our responsibility if you get these side effects because we told you that you could possibly get them.
That was just my comment, John. And some of them even end in, and it may cause death.
Right.
That's right. And
Yeah.
Yeah, one of my daughters is a lawyer, and she advises these pharmaceutical companies on how they should protect themselves by including that language.
Yeah, Dr. Callender, the other thing that's funny about these commercials is they say don't take them if you are allergic to them. Well, how are you going to know if you're allergic to them until you get tested for them and so forth? So that's another ignorant thing that I see on television. Don't take anything if you're allergic to it. That's advice for the wise.
But the other side of that, John Tatum, is how would you know if you're allergic?
That's my question. Yeah.
That's why they put it in there. So they're covered in case you are.
About 20 years ago, there was Little Farmer had a panel of some physicians, different disciplines, and anyway, we met together for about 6 months going over articles and everything. And our conclusion was direct to consumer advertising would be very, very everything that we wrote in our recommendations is what they're doing right now.
Right. Well, anyway, moving on. This is an article that Pfizer's talking about how great the RSV shot and that it maybe not necessarily get more than one shot every 2 years. Pfizer is, as Dr. Perez had said, is really made billions as a consequence of these vaccines. But this is good news in the sense that you may only need a RSV vaccine every other year or so. So we'll see. Let's go to the next one. Oh, it's almost done. This is an article I thought was very interesting that there's no link between habitual caffeine use and migraine, because many people used to think that coffee caused your migraine event to occur. And this article points out that there's no correlation between the migraine headaches and coffee. So it's interesting that this would apply not only to coffee, but caffeinated beverages, which many people take.
Dr. Callender, what do they mean in that first sentence there, with or without aura? What is that?
Aura means that you have a sign before the migraine headache hits you. Could be nausea, or you could have hallucination. You could have any event that before the migraine occurs lets you know that it's coming. That's what an aura is. Some warning sign that you're about to have a headache, and with migraines, they often had auras associated with them, or something that foretold that the migraine was coming.
If you ever get a chance, watch a television program.
Say again? I didn't understand that.
John, did you?
I think he was talking and didn't realize he was talking, so he muted himself.
Oh, I see. Okay. All right. Okay, any other comment about this? I don't know if there's anybody on the line that has migraine, because that's one of the most devastating headaches you can have. Okay, let's go to the next one. Oh, there's an article I put in because it was fascinating to read about how this this driver was blinded by the sun, which occurs if you drive and the sun is gets in your eyes and you can't see. And a mother and her two children walked through the parking lot when the driver got blinded by the bright sun and hit the family. And so the kids in this school finishing up for the day, when they saw this accident, they ran out and they helped lift up the car and save the 3 people who were in this accident. And the way they described it was that the kids saw the accident and they ran out, and God miraculously saved them. And what happened actually is the kids, these little kids, lifted up the car and saved the 3 people from life-threatening injuries. It was almost like a miracle, because all of a sudden all these kids surround and lift up the vehicle, and you wouldn't think they could lift up a car, but they did. So I just thought I'd share that with you. Interesting to see good things. We see so many horrible things. For once in a while, we should show some things that show people love and care for each other. So
This is the last article. I was going to try to watch the video.
Okay. Let's
Okay,
try.
I got to come out for a second. Hold on.
It was a miracle.
Yeah, it was.
Oh my God. You just get to be out here.
Monday, November 9th, 2020, New York City's Madison Square Park. It's a lovely park.
Oh, no, this is not the right article. Sorry.
No.
Park bench, talking to a friend.
Oh,
The
well.
audio wasn't very clear,
Yeah, it
very low.
that's the wrong article. I got the wrong link. Let me see if I can. Well, anyway, Good Samaritan. Sorry about that.
Well, thanks for trying.
Yeah.
Okay. Next week, we're going to have Dr. Shelley McDonald Pinkett, who's going to talk to us about preventive medicine and what we as seniors can do to prevent getting some of these chronic diseases. And so I hope you will invite others to come and join us as Dr. McDonald Pinkett talks about her experiences as a preventive medicine specialist.